the teachers tend to gear their lessons to the problems you're going to be facing as a new nurse. We have a special RN clinical course that helps us go through that time management issue of now we have work and school, we're becoming a new nurse, there's going to be a lot of new training programs at work. So essentially you're doing 2 training programs. You're getting your master's and you're becoming a new nurse, and they do a very good job of helping you understand the conflicts and understand that that's normal and helping you manage your time.
The simulation is fantastic. It's set up like I think it's set up in 2 ways. It can be set up to look and mimic like an ER in the sense that there's a row of patient beds that you have the opportunity to see. Okay, here's one scenario, here's another scenario, and here's another scenario. How are you going to prioritize your care for these patients? Or it can be set up like a med-surg floor where you have an individual patient, and we have that eye stand that can be mimicked and modeled to represent any scenario. And so, you have the opportunity to really fine-tune your skills and practice your skills, whether it's practicing your IV insertions or doing a Foley catheter or just basic care that's necessary in the way that you need to rotate a body for a bed bath, or how you would double check your medications by going through the MAR that the patient might have. It's really prepared me for my experiences in the ER thus far.
When you're in the simulation lab, it's a safe environment. So with whatever we're doing, we have our instructors there. If we make mistakes, it's okay. We're not doing it on real patients, so we kind of get to practice our skills before we take them into the clinical setting. With that being said, things are different in the simulation lab from a hospital, but I think it really helps us to get our confidence in just doing the skills before we actually have to go and do them in front of a live human being that we're taking care of. So it made me feel more confident going into the clinical setting, even though there were differences. At least I had an idea of what I was doing, and I felt safer going into the clinical setting because of that. Having the experience in simulation.
To be a nurse practitioner for me is to be able to access both the medical model and the nursing model at will. The medical model focuses on the disease process and diagnosis and modern medicine, and that's great, it's so necessary. But the nursing model focuses on care and being the patient's advocate. And I wanted to be the type of practitioner that could access both at will. And so for me, this is like the best of both worlds.
The best part of Seminar Weekend is the people that came from outside. Especially, I met a great author. We had an opportunity to meet experts in the field of nursing. We had somebody from Cedars-Sinai who had presented about outreach programs. The experts coming into the Seminar Weekends and giving us updates or giving us advanced knowledge was the key of Seminar Weekends.
Coming to Seminar Weekend, the most wonderful thing about it is that you do get to see them one-on-one, and you get to practice. You get to really hone in on your skills. You get to ask questions, because sometimes looking at the book is way different than actually with one-on-one with a patient. And the faculty are very, very knowledgeable and supportive, and getting to know them and getting to see how they individually see patients and do their exams and diagnose is very, very invaluable. And I feel like that's been the biggest thing. And also getting to talk with your colleagues, other students going through the program too, and sharing notes, talking and supporting one another. I think that has made Seminar Weekends, that's a highlight of Seminar Weekends.
The Seminar Weekend experiences in the nurse practitioner program have been especially useful. I think the component that I have found most beneficial to me are the Sims Labs simulated patient care scenarios, where we actually get to see patients and the faculty is there to observe you and then to give you guidance and feedback afterwards. And so it's an assessment, it's not a test, but you get a sense of where you're at in terms of how you interact with the patients and what your process is in terms of how you would see them in a clinic.
The speed of the program really puts you in a situation where you know what your potential is. You learn about yourself, you know that you are where you're at, you know what you can do, and you just keep on pushing yourself. And once you're done with that first semester, you realize, well, I can do it. I grew so much academically and personally. It's a good balance of helping you think independently, think critically, but also do teamwork. And it's a safe environment because the professor is there and they are guiding you in the right direction. They're not giving you the answers, but they're helping you get to the right answers.
I can recall a time when we were talking about creating a patient care plan, and one of the questions was, who would you involve in the care plan? And the basic things came up: the nurse, the respiratory therapist if necessary, the doctor, physical therapist, occupational therapists. And as it took a nursing student to realize that the patient needed to be a part of that care plan. And so by creating this dialogue with different interprofessionals, you really have the opportunity to create a care plan that's going to have the best patient outcome. And I think that's essential to the future of healthcare and what we're going to do with IPE. So I've really enjoyed it.
I love it. I know that there are some students who aren't necessarily as big of a fan as I am, but I love it. I love going. I love sitting in on the seminar, or we're sitting at a round table and there's one of us represented from each college, and we're given a case study, and basically we're sitting there and we have to come up on our own through discussion, through communication, what is wrong with the patient, what's going on, what are all the factors, the surrounding factors in the case, and what to do about it. And you get to hear everybody's input. You get to hear the vet, the medical student, the optometry student, the pharmacist, and everybody comes to the table with their own unique body of knowledge that they've already started to formulate and craft. And you really get a sense of, wow, we're all coming together for the good of this patient, or for the good of this situation, this person. And I've already feel like I've learned so much. I've listened to the vet students, I've learned things about toxoplasmosis, I've learned things from the pharmacy students, which have served me well in my own pharmacology class. And I can see how it has positively impacted me in my own education. And I really look forward to doing it outside of the classroom.
I'm now in my second semester of the DNP program. I am acquiring the competencies that I'm supposed to have at the end of the program. And so I feel like I'm actually living in my practice setting what I'm learning. And to me, that's incredible.